The lower abdominal test is a great test to determine whether or not the abs are actually strong enough to withstand pelvic rotation, or if the hip flexors and the legs take over. It's a very simple test and a very useful test to also show your clients just what's happening when they're doing leg lifts or knee raises. Quite frankly, what you're gonna see in our protocols is that we don't recommend a lot of leg lifts. We actually don't recommend them at all, or knee lifts. Reason being is that this motion is a leg extensor. And the muscles necessary to do this motion is gonna be our TFL, our psoas, our rectus fem. These are the primary muscles that are used to do this. Now, what we wanna do here is just basically show a client whether or not these exercises could be putting undue strain on their lower back. To do this test, the hand slides underneath the lower back. And if you do me a favor, just sit up for 1 second, Sarah. Nice and tall posture, good. My hand is gonna go on her lower back, but does not cross the spine. So basically my fingers are going to cup the erectors through here as opposed to going all the way across. So she's gonna lay back, my hands go underneath. So you feel your spine right there. I'm gonna go just slightly before that. I'm gonna assist and bring the legs up. Okay, I want you to hold those there, and I want you to push your stomach into my fingers as hard as you can. I'm gonna keep my arm parallel to the floor, perpendicular to her body. I'm gonna slowly create a little bit of pressure trying to pull my fingers out. Very slowly, sir, I want you to slowly lower your legs towards the ground. Keep that tension on my fingers. So right there, this gives out, the pelvis rotates, and she can no longer keep a neutral spine. Now, if she were to actually do leg lifts as an exercise, once she gets to here, all she's doing is working on pelvic rotation and putting a lot of strain on the lower back. This is something that you don't want your clients doing. Even in the event that a client can get to what we call optimal positioning is here without that rotation. All it means that they're able to keep their pelvis in that spot and not put undue strain on the lower back. It's still not a great reason for them to do leg lifts or knee raises. But merely for us, letting them know that they're strong enough to do those exercises, but they will still primarily use their hip flexors.